Hi everybody, it's Jenny from Med Ed again, your CNA instructor. So the next procedure I'd like to go over with you is oral care for an alert and oriented resident. So in this scenario, we have a resident that just cannot use their hands. They can swish, they can spit, they just have maybe severe arthritis, or maybe both of their hands are, sore from falling or something like that. So you start by getting a report from your nurse. Ask your nurse about your resident's needs, abilities, limitations. Annie here has severe arthritis in both her hands and she's unable to brush her teeth. So I've asked my nurse if she's on any swallowing precautions, and she's not. So I've knocked on the door, waited for permission. I've identified myself by name and title. I've called my resident by the name she prefers, and I've explained what I'm going to do. Find and gather your supplies. So for this procedure, you need an emesis basin, toothbrush, toothpaste, lip balm, and then 2 cups. 1 cup is mouthwash diluted 50-50. The other cup is just water. Now we have to dilute the mouthwash 50-50 for a couple of reasons. First, full strength mouthwash can irritate their throat and mouth. And second, some of our residents have dementia or some type of a cognitive impairment. They might swallow instead of spitting it out. So if it's already diluted, it's not going to upset their stomach. So place your resident up in Fowler's position. You want to place a towel underneath the chin. Put on gloves to protect yourself from body fluids. Checking my gloves for rips, holes, and tears. Take your toothbrush, small amount of toothpaste, emesis basin under the chin, brush the top teeth first, then the bottom teeth. Brushing the upper teeth will minimize the production of saliva in the lower part of the mouth. Also, you don't want to brush the bottom and then brush everything from the top back down there. So we brush top, then bottom. Ask them to spit in the basin. Offer to rinse their mouth with water, swish, spit. If requested, mouthwash diluted, swish, spit. Wipe them out. Place your towel at the foot of the bed or in a dirty linen barrel. And apply chapstick, lip balm, lip moisturizer. Now there's 4 surfaces of the mouth that we're checking when we're doing this. TMTL, we're checking teeth, mouth, tongue, and lips. And there's 6 things you're checking for, and if this helps you, I came up with a sentence to help you remember those 6 things. Because when you get to the end of this procedure and you can't name the 6 things that you're checking for, they're not going to be able to pass you on this skill. So the sentence is, big dogs scare lots of children. And the first letter of each one of those words are going to cue you for something to check. So big, B, bleeding. Dogs, D, discoloration. S, scare, sores. L, loose teeth, lots of children. O, of, is for odor. And then C, children, cracks, or chips. So bleeding, discoloration, sores, loose teeth, odor, crackings, and chips. If you find anything unusual, make sure you report it to your nurse. Remove your gloves. Wash your hands. And then do your final steps. A, check alignment, make sure they're comfortable. B, make sure your bed's in the lowest position. C, make sure they have their call light and water. D, ask them if they need anything else. And E, everybody deserves a thank you, so thank your resident. F and G, find and gather your supplies, clean them to company or facility policy. H, ask them how they want those hanging curtains, open or closed. And then eye your way out of the room. I'm gonna wash my hands, I'm gonna do a visual safety check, I'm gonna report unusual findings to my nurse, and then I'm gonna document. Thanks for watching.